Let me introduce Dr. Sreelatha, Professor and Head at ESI, President for Indian Society of Blood Transfusion and Immunotherapy. She is a COVID warrior and Lifetime Achievement Award from ISBTI. And she also worked as Professor and Head of Immunotherapy and Blood Transfusion at Victoria Hospital previously. Now I invite Dr. Sreelatha to give her speech. And please, we'll stick to 10 minutes this time. Sure.
Thank you very much, Mrs. Vidya, for giving the good introduction. Good morning, everyone. Here I come from, I think I should thank Dr. Sunita Agrawal and Mr. Pankaj. I'm here from the first conference which took up, and this is the platform which they have created, wherein all the agriculture, the medical people, and also the engineering, this is the only platform I feel that comes all together for the betterment of the future of you future citizens. So let us give a big, loud applause for the organizers who have taken this stall every year to bring us all together all over the world, not only here, all over the world. So my talk is something different from nanotechnology to the very basic one. So I come from the background of immunohematology and blood transfusion. Of course, it has reached to the extent of the nano, wherein the regenerative therapy and all these things, it comes under my umbrella, the study. But without the basic root, which has to be very strong, we cannot reach to the extent, we cannot reach the sky. So that is how I have come across. And you all know, can you please tell me which is at present, which is a disease which instantly kills us in today's world? The topic is there with that of the cardiac arrest. So it is not the cancer, it is not something else, it is the cardiac arrest. Many of us, I think last 2 weeks, we have lost one of the medical student, just 19 years old. So with that of the heart attack. Is that the way that we need to lose them at that younger age? No, it is not. It is at the present status, we are losing. It is not taking the age, it is not seeing the differences between the gender, nothing of that sort. So in this world, I thought this is the topic which gave insight and opened my eyes to. That is what I'm going to share with you. And it is whether you are, I'm seeing in the audience, whether you are a medical student, the nursing students or the engineering students or otherwise the other BCom students are also here. I do find them here. I have interacted with you people yesterday. I'm glad that you are all here. But the basic thing is, without having the good health, how can you proceed with your research work? So to have that, I have come here. So this is what is the building. And this is the study which opened up my eyes to, and that is how I started my, of course, being healthy. So what do you think that my age could be? Yes? Yes? Take a guess. Which number do you like? Sorry, 80? Yes? Yes, so please tell. There's nothing wrong in it. This is not, I'm not giving you any marks or something like that. You can go ahead and tell the wrong thing also. Yes, 30. Something is showing 3, 4, 40. Okay, no, I'm sweet 60. 60, not 16, sweet 60. So I have just recently retired from BMCRI, the Bangalore Medical College and Victoria Hospital, and joined to the ESI. So how am I healthy? So how I adopted and why I adopted. At the age of 50, I took up this blood donation. So why not you people? So this is the article which shows that, which gave me an insight, which opened up my eyes. And this is what now the cardiac arrest is more, which is causing the 85% of the death, which is the cause for the death in today's world. So should you succumb for that? So that is a research that tells you. So if we go on to this article, So it says why and what. It is not there in any of the curriculum, but it is there in this, the original, the article which was been studied. We being in the medical field and then the college will be going through what is the latest which is happening around the world, and that is how I found this is very interesting. So this is, in this article it says that the cause is there within us. Okay, the one, all of you must have read about the red blood cells. So the red blood cells, the lifespan of the red blood cells is just 120 days. So this 120 days, will it differ from that of the person who is in US, the African or the we Indians or Chinese or anything? Or is it taking a difference from that of the gender difference? Or is it taking a difference from that of the, whether you be being as a B negative or O negative or A positive, B positive? Nothing of that difference. So for everyone, it is 120 days itself. This 120 days is the cause for the heart attack. So this 120 days, the cell is biconcave. One of the speakers spoke on the sickle cell also. So the sickle cell, yes. So all these things, it will have the cytoskeleton, like how we have the skeletal structure. The cells, each of the cells in our body have the cell, the cytoskeleton. This, the 120 days, which is growing old, it cannot squeeze in into the very tiny blood vessels, which are there as thin as your single hair strand is. So here is the pathology where what happens. It cannot squeeze in. So I have my restrictions. When I go into the, if I happen to go into the cave, I cannot crawl and go. So if you, the people who are behind me also get stuck. So if you allow the 7 years boy or someone, he'll crawl and make the way for the others. So in the similar way, the pathology happens at the vasa vasorum. So this vasa vasorums are the blood vessel to a blood vessel, bigger blood vessels. They are in millions in our body. So this is where, when the blood stucks there, it cannot have the spontaneous blood flow. When the spontaneous blood flow cannot be there in the very sensitive organs, that is heart and the brain, so it brings about the, in the form of the heart attack. So do you want this or do you want to avoid? So the study went on to say, yes, what is the solution? So the solution is nothing but having the blood, the new blood cells often. So according to this study, so by donating twice a year our blood, so twice a year, we can reduce the incidences to 80 to 88% of this heart attack. Do you want or not? You think about, you're all grown up, you're all 18 years and above. Of course, that is what the criteria I'll be coming across now. So how to reach? Just if you say, yes, come, we can draw, no. You should come to some criteria also. So anybody who has donated blood here in this, so big, 2 hands I can see. Yes, oh, good, good, good. Give them a good big cloud of applause here. So thank you everybody. At least a few hands, about 5% of the audience are there who have donated the blood and experienced it. It is not painless. It is as sweet as an ant bite. Is that so, sir? So don't you fear for that, that there is a needle and it will be a painful procedure. It is just 5 minutes it just takes, and not all the blood. In our body, just 6 liters of blood will be there. Out of that, we'll be drawing just 350 to 450 ml. That means to say your lassi glass of blood itself. Okay? So the criteria stands as whoever is 18 years and above till 65 years. I have already donated twice, so I am planning here now again on October 1st, which is coming up as a National Blood Donation Day. So the weight should be 45 kgs and above. The hemoglobin, irrespective of whoever it might be, it should be 12.5 grams and above. Not all the females of India will be reaching to this hemoglobin level. We can improve the weight and as well as the hemoglobin value. So blood group, everyone, all of us, whether we are negative blood group or positive, we should donate twice a year. Then only we can get the effect of reducing the incidences of heart attack and stroke also. So This is where it helps all. This is, okay. I'll just skip this. The criteria goes on. The BP also will be checked, which should all be uh, normal. The sleep, at least 6 hours of normal sleep one should have. And of course, you should avoid the tablets and the habits like smoking and alcohol for 24 hours. Yes, the heart attack, you can see that it is 88% it will get reduced, and cholesterol, of course, it will be 44%, it will be taken out from the blood if you are becoming a blood donor, and blood loss and others like liver diseases and cancer also gets detected. Like early days, it is not so. Like earlier days, the blood used to go from one person to the other person. The older movies, have you watched the older movies? Amar Akbar, Anthony, if you like. If you watch it, earlier movies, one person used to donate, the other person used to receive and become bhai. Like that, it is not so. We need to take this blood, the donor's blood, and detect for the other diseases, major diseases like HIV, HPSAG, HCV. It takes nearly one complete day to detect the diseases. It's not like give it away instantly to the patient. So it gets checked up there, that 1% of the donors also get checked up whether they are in the precancerous stage. So is it not a benefit? If they were to be a precancerous state, their treatment and all these things, it becomes very easy. The patient will recover fast and his lifespan will be probably from 15 years to 20 years he can stay with us. So this is that video. Of course, you must have watched that video. It never says, it never exempts us from any profession, whether you are a journalist or a singer or whoever it might be, it's all the same. So that was about that. And the effect you can see, yes, what is the effect of this blood donation? How many lives could it save from what we donate 1 unit? What can you say about that? How many lives can we save? Yes? Take a chance again. 1, 2, 3, 3. Okay, you stand for 3. So it is not so. In today's world where the technology is ahead, it is saving at one time of donation, it is saving nearly 10 to 12 lives at one given time. Don't you feel happy about it? Can we save so many lives at one time when we donate any other parts of our body? Can we donate any other parts of our body while we are alive? That's the main thing. Yes? Can we donate? Yes. Kidney we can donate, but we'll have a lot of after effects about that, BP, sugar and all these things. I think it will shoot up since one kidney has to take up that load. So you will get to have all the BP and sugar, all these things, problems within a short time. So such sort of side effects is not at all there in this blood donation. So you'll have all the benefits only, not just saving somebody else's life, nearly 10 to 12 lives. You will have nearly about 18 days, 18 diseases. Your body says, if your blood has gone to the other person, that means to say your body is free from 18 diseases, free of cost. Do you want or not? If you get tested, you'll have to spend nearly 5,000 rupees. So this is free of cost. You will have the gratitude. Today is a International Day of Gratitude. So you will have that gratitude also. You will have this is Peace Day also today, and Alzheimer's Day also today, International Day of Alzheimer's, International Day of Peace, International Day of Gratitude. So all these things you will find it once you start becoming a good donor. So do you want or not, you're all grown up. So whatever you might take up your profession, future profession, you will have to be strong enough. So once you are strong enough, then only you can go ahead with your dreams. So this is what I say. The need for the blood is, of course, too much. Nearly 16 to 18% in today's world, but it is happening just 1 to 2%. Of course, the sickle cell anemia and other thalassemia, they need it daily. Okay, it's a genetic encountering disease. So here is a solution. So one who have, what I did was, that's what I'm sharing with you. So you can see my thyroid, I'm having a thyroid problem also. I am a thyroid patient also. So my hemoglobin was fluctuating between 9 to 10, 9 to 10 most of the time. So what I did to become a donor and what I chose and why I chose, like how you can also adopt it, that's what I'm going to share. So I chose this beetroot. All of you must have tasted beetroot. Do you all like the beetroot? Whether you like or not, it is not a bitter ground. It's a tasty. You can make it still more tasty by putting the lemon juice, which is ascorbic acid, which helps in absorption, more absorption. You can put a little bit of salt, sprinkle salt and pepper to it. 5 minutes, you can eat it. If you like sweet jaggery water, you can sprinkle it and leave it for 5 minutes and consume it. So the next one is I did not chose the ones which are there that side that.
Ma'am, you may have to wind. Fine.
Oh, it is going back. So why I did not choose the other which are there in the market or which we can consume. We all need to cook. We are not carnivorous. We are not herbivorous. Totally. We are evolved. We are evolved to that extent that we need all masalas and all these things, fries and all these things. We cannot go ahead with anything else. So that is why I chose this part. So the next one is ragi porridge. This next alternative you can give us the ragi porridge. Ragi balls will not help much. So next one is the dry fruits. This I took up for the MNCs. MNCs we used to go for the camps where every alternatively, but they were not able to donate the blood. So I suggested, of course, before Corona, they were all being picked up by the cabs. So at the midnight, we cannot suggest them ragi porridge or the peel of the beetroot. Raw beetroot you should consume 100 grams. So this is what I
Dr.
gave
Sreelatha,
them.
ma'am, you may
Yes,
have
1
to
minute. The
wind
main
up.
thing.
Yeah.
Main thing I'm coming up. So
Please wind up in the interest of time.
yes, this is the last slide.
Okay, thank you.
So you don't want the mass to be healthy?
No, just
so
want
if
to
you
give
want
it.
the healthy, yes.
Just want
I'm also there, I can understand. So this is the last one. So the dry fruits, when I took up, I do not picked up the pista or the badam, which are rich in the fat. So I chose in the formula of 5 to 5 to 15 is to 15. So 5 is the anjir, the dry fig. The 5 is, another 5 is the dates. 15 number of dry resins and 15 number of the almonds. So all put together, when I gave them this solution, they were ready to donate the blood by the time we went next time. So this is what I chose, and you can choose one of this or in combination of this to be healthy, and for the future, your endeavors, you can go ahead with it. So this is what the myths and facts. It is not painful at all. It is sweet as an ant bite. So this is how the processing happens. It is not just the color we give it. So it needs lot of efforts to be done. So this particular doctor intern, she came to the level of blood donation within 19 days. So you can also do it. So camps we do regularly, not all the, even temples, mosques and churches everywhere we do go. So you can see the physically challenging person on the right side who has also donated. So this is the athlete. He is a football athlete who has donated. So this is how we celebrate World Blood Donors Day. So thank you everyone. So you
Thank
can
you.
have a good health.